Hi, and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And every week I answer your questions. So if you are confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. Let's get started. As a caveat, as always, I can't answer personal medical questions because I'm not your personal doctor. So if your question is a little more personal, I'm going to change it a little bit so it's more broadly educationally applicable. Also, if you want to work with me, I will leave that info below. And let's get started. So this first one is so good for so many reasons. It's not so much a question as a statement, but I really wanted to share it because I think it's very helpful for people. So, this is somebody who said, I'm in my second week of Zepbound 2.5 and noticed a feeling of boredom and not sure what to do with myself now that food doesn't take my day over. And I think that we talk so much about how these medications really decrease the food noise, and that's so nice. But I think this really points out how, there's kind of like a hidden incentive to how we use food sometimes, right? So not having that anymore kind of points out how somebody might use food in a way that is, not just for nourishment, but also for entertainment, to help with boredom, to help with sadness. Like there's so many other reasons why people eat. And I think sometimes it can feel a little bit like, the rug got pulled out from under people because they're like, oh, okay, that was clearly taking up a lot of my time. And now it's just me and these like uncomfortable feelings that I was masking with the food. And so I think, thank you so much for writing in because that's really good insight for you to have. And I think it's good for other people to recognize if you feel a little like, oh, okay, unsettled, I think can happen for people. And you just want to make sure that you're not replacing it with something else. I would much rather have people, uncomfortable feelings, or feeling kind of unsettled or bored or unhappy. Like that's just what your body, that's kind of what's going on with you. That's the truth, right? And so what I don't want people to do is use something else to just cover that up in a different way, right? So you have to be careful that, okay, now this way of dealing with feelings is now gone. Do not replace it with alcohol, marijuana, other recreational drugs, video games, compulsive spending. Like there's so many ways that we as humans anesthetize ourselves and kind of take our minds off of what's really going on with us. And so, what this commenter has so insightfully seen is that food was a big source of that for this person, and now it's gone. And now what are they going to do? So, I really want people to, you want to get comfortable with being uncomfortable. That's kind of the growth, the discomfort of growth, and going through this process can be a little unsettling for people. And so I just want you to know that it's not a problem, actually. If you feel a little unmoored by this change, it's not, it doesn't have to be a problem. It's just good to know and good to see that food was serving this purpose and now it's not. And so what you really want to do is kind of think about why, or the reasons why you were having these uncomfortable feelings, right? It's good to feel your feelings. And so these medications can really help with that, but it also can be a little unsettling for people. So if you need a therapist, if you need to talk to a friend, just figure out what you need that was going to be helpful for you, but also just make sure that you're not turning to something else to mask the discomfort, because doing that is going to cause, having an uncomfortable feeling isn't going to hurt you, but masking it will. And of course, I'm not talking about people who are, the very low percentage of people who have mental health changes on this medication. You also want to make sure that you're looking out for that too. So if you have really serious kind of out of the norm changes to your mental health, you definitely want to talk to your prescribing physician about that. But if you're just feeling like there's a kind of a gap now where food used to fill things, that's actually a much better place to be than kind of covering it up with food or substances or anything else. So thank you so much for sharing that. I think that is I think that will help a lot of people. Next question: do you think metformin is helpful if somebody has been on a GLP-1 injectable and lost weight to maintain? That's a really good question. I'm guessing that this question is really about if this person goes off the GLP-1 and then kind of swaps it with metformin. And we, of course, we don't really have the research yet to kind of back all these kind of nuances to the medications yet. But I will say that in general, what tends to happen, what we have seen with the research is when people go off their GLP-1 medication, the weight does tend to come back on over time. It's not overnight, but it does tend to creep back on. Now, so for that reason, I always, for right now, for this moment in time, where we are with the research and the science, I always tell people, if you're going to go on a GLP-1, you really have to have the mindset of this is a forever medication and not a one-off that you're going to be on for like a year and then go off, because we, right now, that's just kind of how things are. So right now, I am not recommending that people stop their GLP-1 and switch to metformin. I think you could certainly, in theory, you could think about, I just made a video actually about metformin. So you can add metformin to a GLP-1 to try to get an added benefit in terms of weight loss. And I kind of go into all the nuances about that in the video. But I am not going to be swapping one for the other right now, knowing what I know about metformin, which can be very helpful for some people, but certainly is in general not as effective as a GLP-1 agonist, and also knowing that for most people, the weight does tend to go back on. Are there some people that go off their GLP-1s and don't really regain the weight? Yes, I'm sure there are those people. Are they in the minority? Yes. Everybody is free to do what they want. They can stay on the medication, they can go off the medication, but that's not what I, in general, medically advise my patients. So that is a great question. Okay, this next question is a little long. I'm going to shorten it. This person had been on Mounjaro. Now they switched to Zepbound. They have the real problem they're having is energy and motivation. It's like I just can't get excited or happy about my workouts. I'm just tired all the time. That is a great question. So definitely I do hear that people get fatigued a lot on these medications. And for some people, it is really timed to when they have the injection. And for some people, they're just kind of low grade tired all the time. Of course, you want to make sure you're hydrated. Of course, you want to check in with your doctor, make sure your labs are looking good, that your thyroid is good. Of course, you want to make sure that your nutrition is optimized and that you're getting enough protein and that you're not anemic and all those things. You want to do all that, check in with your physician, but also know that fatigue is a known side effect of the GLP-1 medications, and some people just feel really wiped out. So that is not uncommon. Sometimes it goes away. Sometimes it's very dose dependent. I also never... what I tell people is don't wait to feel good about working out to work out, because, working out is not a natural thing that humans do. We didn't evolve to go to the gym. It's unnatural. It's our way of adjusting to this very, particular modern society where instead of farming all day or, building buildings all day or whatever it is we did, 1,000, 2,000 years ago, we now can sit all day. And so we have to counteract that with exercise. Whereas, 2,000 years ago, nobody would be freely exercising because they were more worried about famine. So there's nothing wrong with you if you don't want to exercise. And I never want people to kind of feel like there is something wrong if they don't feel like motivated to exercise. That's one thing. But it is, it's a different thing if you feel really wiped out, like energetically, it's hard to go to the gym. So for those people, definitely know that that is a side effect. You might want to talk to your prescribing physician about changing the dosage or going down a dose, but also make sure that your nutrition's optimized, you're hydrated, have them check your labs, do all those things too, just to make sure there's nothing else going on. But yes, fatigue is definitely a known side effect. So good luck. Next question is, I'm freezing cold for quite a while on Mounjaro. My thyroid levels are normal. I'm thinking of not taking Mounjaro any longer because it's so bothersome. And they say that their nutrition is good as well. So that is a great question. I think it's great that you checked your thyroid. That's one of the first things you want to do. But also, I would say it depends, everybody's going to be different, but it also depends on how much weight you've lost and how quickly you've lost it. So if somebody's lost kind of more than a couple pounds a month, fat is insulating. And so, yes, you're losing weight and that's good, but you're also removing insulation from your body. And so that can be, depending on the rate that is happening, that can be a little jarring. And of course, people who have a lower body weight are often cold much of the time. It also depends on where you live and things like that. So in theory, for those who are cold a lot, it might be the type of thing where somebody needs to give their body a little bit more time to catch up and really think about how quickly the weight has come off. And that's somebody that, if that was my patient, I might think about taking them, not escalating their dose very quickly. I also have patients that, before they start the medication, they're telling me like, I'm sweating all the time. I'm so warm. There's something wrong with me, and then they lose the weight and that disappears. So sometimes it's a very big change, getting rid of that extra body weight, which is insulating, and it does have inflammatory properties as well. So somebody could go from, in comparison with how they were feeling previously, being more like having less hot flashes or sweating, is going to be quite a different experience than what they had been having before. And for many people, that's been kind of their norm for years and years. So that's also something to think about as well, as what was it like before you started the medication? Are you somebody who, you were really comfortable temperature wise, or you felt like you were really sweating a lot or overheating a lot or uncomfortable in that way as well? So, but as always, for any of these questions, check in with your personal doctor as well. Make sure nothing else is going on. But those are some things I would think about in comparison to the experiences that you're having now. That's going to do it for today. Thank you so much for watching. If you want to work with me directly, I'll leave that info down below. And please be well.